So, without further ado, I would like to introduce you to the topic of this afternoon, which is indeed a short talk on mobilizing citizen science in support of health research and health service provision. And I would like to stress that I take here the hat of a researcher, but I am myself a legal practitioner. I'm actually an environmental lawyer. So I've been working in the last year on these matters from both a research and a practice perspective. And I hope that some of the learnings can be useful for those of you that belong to the citizen science communities, but also those of you that are indeed health and medical practitioners. I also would like to stress that after my talk, there will be a Q&A, so please hold on your questions and ensure that you can pose them at the end. Also, if you have clarificatory questions, feel free to use the chat. We will ensure to address them. Let's start without assuming that you know what is citizen science. And also, I would like to share with you how and why I did discover this charming field, at least I find it charming, of citizen science. All right, so when you hear citizen science words, you connect two dimensions. One is that of people, all of us as ordinary people that are concerned about what surrounds us, which can be an environmental issue, can be a medical condition, can be a social problem like urban inequality. And all these matters are concerning even more when the institutions responsible for handling them tend not to address them, to forget them, or maybe they just don't have the resources to properly monitor them. So I regard the mobilization of ordinary people around matters of concerns as a form of democratic participation. And this can be applied to different scientific domains, both in the so-called hard sciences, but also in the social sciences. So citizen science can effectively be considered a form of participation of ordinary people in the scientific process. So, for example, through data collection, data analysis, and dissemination of results from the very start. So from the moment where we question what is our research question to the moment where we gather data and we analyze data. So we can talk about citizen environmental science, citizen social science, citizen medical science, citizen health science, and so on and so forth. So citizen science is really a modular practice that can be applied to different domains. My personal passion towards citizen science has been in the intersection between citizen participation and environmental matters that also included a component of health, because people were really concerned about their right to a healthy environment. In this picture, you see a scary landscape. There is an oil extraction site, and this site is located in the south of my country, in the south of Italy, but it could be placed in Ecuador, in Texas, in Norway, in many other countries in the world, because still oil extraction is a problem. And what you see on the top of this pipe, it's actually gas flaring. It's the burning of oil byproducts. And this is deeply problematic for our health, for human health, and for the breathing from the air, because the impact of this burning has serious epidemiological effects. And in fact, both people and animals that live in this context, in these regions surrounding oil extraction sites, suffer from cancer, neurological diseases, respiratory diseases associated with oil extraction. And this is why some years ago, a project was kicked off, actually together with a very well-renowned professor at the University of Padova, Professor Annibale Biggeri, together with the region of Basilicata, but together with many citizen volunteers, associations that aimed at mapping the health impacts on the local population from a very, very medical point of view. So really looking at how people would get ill, have diseases associated with oil extraction. And this was done through participatory mapping, through popular epidemiology, which is form of citizen science where ordinary people are invited to contribute to the process of scientific research through mapping their own health. So these people, for example, they were asked to give blood samples, to give their health records, to share with researchers, but also with policymakers, the results of their medical checkups, to understand to what extent extraction of oil in the region caused health conditions. Why this is interesting? Because this should already open our eyes on the sensitive nature of all these cases where citizens are asked to participate in citizen science activities by contributing their own health data, which you know probably better than me if you are in the medical sector, are extremely sensitive, are special category of data. So I am very fascinated by the intersection between citizens and matter of concerns that manifest through practices of citizen science. Now, let me share with you some conceptualization to really understand what is citizen science. So I see a comment in the chat. If there is any burning question, I invite Corina to interrupt me and pause it because I won't be able right now to see the chat. Thank you.
Of course.
So to define citizen science, there has been a lot of scientific work. So something that I would like to stress is that we cannot agree on a definition of citizen science. And many practitioners and researchers actually suggested to use participatory science because they found problematic the word citizen, because citizen suggests somebody who has a citizenship of a specific place. Whereas in citizen science, the idea is that everyone is invited to participate, even people that are not citizen of a certain country. So I would say I'm both in favor of participatory science, civic science, citizen science. I really would like to transfer you the meaning of this concept. So, as I was mentioning, citizen science is essentially a whole set of practices where ordinary people contribute to scientific research. But the level of participation can be somehow growing in a sort of ladder. So essentially, in citizen science typologies, we say that contributory citizen science is a type of citizen science where participants offer data that they had collected to scientists. So they contribute to a scientific process, but they're not necessarily engaged in the full process. In collaborative citizen science, already there is a next level of collaboration, which is really to contribute to the research design and data analysis. And it really ensures that the contribution from citizen science is brought to follow up the problem solving phase. In co-created citizen science, we really reach the higher level, so where citizens are considered equal partners to the scientist, and they can really own the results. And for example, they are cited as co-authors. I have many good examples of citizen scientists being listed as co-authors, which is a practice that really poses citizen and scientists at the same level. Now, I would like to cite also the diversity of data collection approaches. For example, you may have heard about citizen-generated content. This is not necessarily citizen science because it's a form of grabbing data from citizens that produce data without necessarily the intention to contribute. So it's a sort of passive contribution. Imagine when you do a social media scrolling or Google search into some matter. Essentially, you're contributing your data. Imagine your GPS data. This is somehow not really citizen science, of course, but can still contribute to scientific insights. In crowdsourcing, which is already a level up, citizens contribute with some tasks, time, or even money to a scientific process. And often this is when, for example, a big emergency occurs. Do you remember the pandemic where everyone was asked to feed data to platforms or maybe to dedicate some of their time to inform the Red Cross about houses with old people where there was a need? So in a way, crowdsourcing is really asking to a crowd of people to perform an easy task, something that doesn't necessarily need a scientific training. Citizen science is much more. It's really about engaging people in scientific discovery, eventually also contribution to policy, foster their education and community building. So, of course, data democracy is a big term that Kralja and Shanley use, but the idea is that the more we go up in the ladder, the more people really contribute to forms of data and scientific democracy. And lastly, Hackley with the Excites project Extreme Citizen Science really looked at extreme level of participation where the idea is that people gather data collectively as a community to ask for action, to really ask for change. And I have to say, the majority of projects I've been supporting or contributing to are in the extreme citizen science domain because they are really projects that do not only support scientists, they really want to bring forward a change, which can be through, for example, court cases, can be through street protests, can be through media campaigns, but they really want this data to go somewhere. As Web2Learn and me collaborated in the past already, I would like to stress that there is yet another domain where citizen science has been mobilized. And this is essentially citing the words of Doug Ware and the CEOBS, the Conflict and Environment Observatory, also in the field of war and the impacts of wars on the environment, but also, for example, on mental health. And this we call civilian science, which is citizen science performed by people during armed conflicts. And I find it fascinating as an example of really how people respond to stressors in a participatory way. And indeed, civilian science builds on both citizen science and civic monitoring, which are forms of observation performed by citizens without necessarily a scientific component, but it performs of all that in context of armed conflicts. So really in extreme situation where the basic of our life is at risk. But let's move to the juice of this class, which is how can we bring citizen science and health research together? And in particular, let's question how the practice of citizen science is effectively contributing to engaging patients, to stimulate knowledge production, and to foster community-based research. Now, first of all, imagine to be a patient with a chronic disease and being for years struggling with this disease. You would definitely be inclined, interested in contributing to advancing research on your disease, which can be, for example, a rare disease. So each singular experience matters to advance the field. Imagine also to be a doctor researching a particular genetic disease. You really would want your patients to not only be passive receivers of your knowledge, but also to contribute to knowledge production. And lastly, imagine to be a community affected by a widespread disease like air pollution related to the presence of an industrial facility. How important is collectively to know that your neighbor suffered the same asthma or lung cancer, and then unite the dots and understanding that this is a widespread condition. So I would like to first mention that there is at the European Citizen Science Association level a working group that is uniting this thought and is actually looking at how citizen science can contribute to public health. In particular, they are looking at both these sort of movements associated with the quantified self. So the idea that you can track your body, you can track your health, which would be addressed in the last part of this webinar on the personalization theme. But what interests me in this field is how the working group is actually looking at not only the scientific contribution of health citizen science, but also the social contribution. So really the social meaning of joining a health citizen science project. Now, this working group aims to fuel a community of practitioners and stakeholders interested in the domain, to disseminate tools, methods, ethical frameworks, and training in the field, and to enhance visibility and potential of citizen science projects in this domain. They organized webinar, conferences, and they are very, very active. So I actually invite you all, if you're interested, to consider joining this working group. It is free. If you are a member of EXA, better, but you're not obliged to be a member of the association to join the working group. By the way, if you would be interested in the EXA working group on civilian science, so on citizen science during armed conflicts, Together with Web2Learn, CEOBS, and other colleagues, we actually funded one working group explicitly dedicated to that. So this is also something that you're very welcome to consider joining. But again, this is not the focus of this class. So I will just now focus on the intersection between citizen science and health medical research. Now, I would like to show you the diversity of applications of the practice. And this goes, as I was mentioning, to citizen science for mental health, which is really a field that is quite understudied in terms of how people perceive mental health troubles, how they manage mental health challenges, how can people contribute to understand their mental health. This is, for example, a banner of a project kicked off by the University of Nottingham, where people above 18 could contribute and actually support research in the mental health domain, sharing their experiences. Another case that I really would like to welcome your interest and stimulate your interest towards is again on a very understudied topic, which is on the health of the vaginal microbiome of women or people identifying themselves as such. And the idea of this project, which actually got many prizes, is called ISALA, was to create typologies of these microbiome diversities, inviting people to essentially monitor their vaginal microbiome. And this is a project that really became popular and managed to engage 6,000 people and actually to identify 10 types of the most important bacteria to be found in this microbiome. And it's also a way to, let's say, promote, foster gender diversity in research on this topic, which has actually been dominated by male doctors, and male researchers. So the idea was to bring more youth, a diversity of participants, people from minorities, to ensure that also this diversity in our microbiome biome could be represented. And lastly, a project from my country, Italy, where the idea of citizen science applied to health was actually framed in this One Health approach. So the idea that the status of the environment connects to our health, and throughout this project, which was rather top down because it was also supported by the Ministry of Health in Italy and EU funding, was to really stimulate thinking at the crossover between environmental health and human health, also in light of avoiding future pandemics. As we know, One Health approach is really looking at how we can manage our environmental challenges in a way that don't impact on our health, or to minimize the impacts of our environmental stressors on our health. So again, these are just examples. But what all these suggest to us, first, is that there are numerous ethical challenges when we ask people to contribute with health data, with mental health experiences, with other forms of, let's say, information. Imagine in the Isala case, you had to ship some samples, so really your body parts, which is something that can be problematic, for example, in terms of taking responsibility for eventual risks of, for example, data leakages. There is a whole field associated with intellectual property, how to share fairly the results. a matter of culture. So culture can vary, and in different cultures, the idea of talking about certain matters may be more problematic. And again, the problem with resources allocation in to ensure that also people that perhaps cannot access to have a phone with an app can still afford to participate in a project. And this also brings me to this big topic of the European data, let's say, the evolving field of the European data protection legal frameworks, the GDPR, General Data Protection Regulation. As you know, there are a set of principles that we still and always have to consider when we engage in data processing. And these are, of course, a legal basis, fairness and transparencies, limiting to the purpose that was initially identified, minimizing the data collection to what is needed, ensure accuracy, limit the storage so you don't go beyond years because it then may be useless and dangerous, ensuring indeed data integrity and confidentiality, and ensuring also accountability. So disclose your privacy efforts and ensure that you're always complying with the norms. So of course, these entail researcher fit for this type of work, which is not necessarily something that a researcher would want to add on their desk, or a doctor, that are people that are generally very busy and they may struggle to also comply with all this extra work that engaging in a citizen science project may entail. I would like to cite two resources that will be shared by Web2Learn with all of you through the Mattis channels. One is an open access article that I wrote some years ago with a colleague, Robin Pierce, on the challenge for citizen science under the GDPR, in particularly focusing on health citizen science projects. And this was, of course, now it seems ages ago, but still is very actual and actually very used by practitioners to orient themselves on the possible risks from a GDPR point of view of engaging in citizen science projects. And also, this builds a bridge to the last module of this class, which is what I called data altruism. I didn't call it myself. It's actually a EU concept. We will define it together, and it connects also to this idea that you can personalize your medical interventions from below. So really feeding the medical both the doctors that are following you, but also the research that is being conducted around things that for you matter. Like we saw with the ISALA project on microbiome, ideally you discover more about your microbiome and you can ask for more informed interventions. And there are a number of related challenges on both the data altruism side and the personalization from below side. So here again, I would like to show you an example of a project which is called the Cochrane Crowd. And the idea of this crowd is that people from very different backgrounds are invited to share their healthcare conditions to diversify the evidence on which researchers in the health domain can base their studies on. And this, of course, as an interesting dimension, which is why people decide to participate. They want to have better healthcare decisions. They want to inform the state-of-the-art science to ensure that people with their same problems can be treated better. But at the same time, it raised question about free, aware, actual consent, because the Cochrane Crowd uses a very telling and stimulating approach pushing people somehow to deliver their data, to make a difference, to really advance health evidence. And the question is like, maybe a person under a stressful health condition is pushed to share more than what they would want to because of their concern towards, for example, not having enough data for other patients. So this altruistic idea that you donate your data on one side is great. On the other side, poses question: is this person fully aware of the data that they are giving away? Even if it says in anonymous form, still there is the question of whether anonymity can really be preserved, because many times there is pseudonymization, which is actually using pseudonymous, which can reconnect it to people's names by the researcher if needed with a certain security keys, but it's still considered not fully anonymous. So the questions are still there. Now, what is data altruism? Actually, in recent years, the European Commission has been pushing for a sort of more and more an altruistic society where people donate, in particular data holders, which can be governments, corporations, researchers, citizens, but also NGOs or non-profit organizations, contribute data that they had collected, ensuring privacy through set guidelines and creating trust bonds with interested data users, which again can be governments, corporations, so on and so forth. And the idea is that in these ecosystems, the data can be used only for the public good. So for advancing research, improving service provisions, ensuring that governments, the public sector can operate based on this data more efficiently. But the open question is still, how fit is this system for purposes? Now, what we saw is, for example, that the anonymization, so the fact that in the end it becomes non-personal data, is being respected. So it's really aggregated data that do not pose GDPR issues. But on the downside, the register of data altruism organization curated by the European Commission so far is being very scarcely populated. So it's really difficult to say to what extent data altruism organizations are joining this initiative. And in the readings, there is actually an article published in Frontiers in Sociology, which really looks at data altruism as an interesting trend that can contribute to this idea of personalizing your medical interventions from below, so really from the perspective of the affected person. And lastly, I would like to show you an interesting bottom-up initiative, which really started from below. This is actually a Spanish, actually Catalonia case, where the idea of this cooperative was to engage participants to distribute and share their health data to contribute to the common good. So this is a bit of a translation of what is that, with ensuring anonymity. And again, the question is, this project aims to do a social transformation where everyone feels happy to share their data from a medical point of view, and this should advance research for the common good, and this goes through an app. It's great. On the downside, I still feel that people should really be informed well to ensure that they can join this project with awareness without exposing themselves to risks. So I hope that what I showed you sparked your interest I also am very, very curious to hear if there are questions. And again, I'm happy to also answer any follow-up questions if you have with my email. You find it here, and I invite you to follow two projects that I'm currently running. One is called Sensing for Justice, and the other is called Persona. Here you find the handles. So